Erythropoiesis. Erythropoiesis is the process of the origin and development and maturation of erythrocyte. Erythropoiesis. Poiesis means production. Erythro RBC. Erythropoiesis is the process of the origin, development, and maturation of erythrocyte. Site of erythropoiesis in fetal life. In fetal life, mesenchyme of yolk sac, liver, and finally the RBCs are produced from the red bone marrow and liver. In fetal life, mesenchyme of yolk sac, liver, then red bone marrow is going to produce the RBC. In newborn babies, children, and adults, only from the red bone marrow. Up to the age of 20 years, from red bone marrow of all bones. After the age of 20 years, from membranous bones like vertebra, sternum, ribs, scapula, and from the ends of long bone. So, up to the age of 20 years, only all the red bone marrow of all bones. After the age of 20 years, only membranous bones like vertebra, sternum, and ribs, scapula, and from the ends of long bones. The shaft of the long bones become yellow bone marrow because of fat deposition and loses the erythropoietic function. The shaft of the long bone slowly become yellow bone marrow because of fat deposition and loses this erythropoietic function. Changes during erythropoiesis. Reduction in size of the cell, disappearance of nucleoli and nucleus, appearance of hemoglobin, reduction in size of the cell, disappearance of nucleoli and nucleus, appearance of hemoglobin, change in the staining properties of the cytoplasm. Stages of erythropoiesis, various stages between CFU, E cells, and matured RBC are proerythroblast, early normoblast, intermediate normoblast, late normoblast, reticulocyte, matured erythrocyte. Proerythroblast, early normoblast, intermediate normoblast, late normoblast, reticulocyte, matured erythrocyte. Factors necessary for erythropoiesis. General factor, maturation factor, factor necessary for hemoglobin formation. First of all, general factor. Erythropoietin. Most important factor for erythropoiesis is the hormone called erythropoietin, a hormone from kidney. Most important factor for erythropoiesis is the hormone called erythropoietin. Erythropoietin is a glycoprotein, source of secretion. Major quantity of erythropoietin secreted by peritubular capillaries of kidney. Major quantity of erythropoietin secreted by peritubular capillaries of kidney. Stimulant for secretion. Hypoxia is a stimulant for the secretion of erythropoietin. Hypoxia is the stimulant for the secretion of erythropoietin. Actions of erythropoietin. Increase production of proerythroblast from CFUE of the bone marrow. Increase production of proerythroblast from CFUE of the bone marrow. Development of proerythroblast into matured RBC. Increased release of matured erythrocytes into blood. Blood level of erythropoietin increases in anemia. Thyroxine accelerates the process of erythropoiesis at many levels. Hematopoietic growth factor. Hematopoietic growth factors are the interleukins and stem cell factor which increase RBC formation. Maturation factor. Vitamin B12, intrinsic factor, and folic acid are the necessary for the maturation of RBCs. Vitamin B12, intrinsic factor, folic acid are necessary for the maturation of RBCs. Vitamin B12 is essential for the synthesis of DNA in RBC. Vitamin B12 is essential for the synthesis of DNA in RBC. Its deficiency, vitamin B12 deficiency leads to failure in maturation of the cell and reduction in the cell division. Deficiency of vitamin B12 cause pernicious anemia. Vitamin B12 deficiency cause pernicious anemia. Intrinsic factor of Casil intrinsic factor. Intrinsic factor of Casil produced in gastric mucosa by the parietal cells of the gastric gland. It is essential for the absorption of vitamin B12 from the intestine. Folic acid is essential for maturation. It is required for the synthesis of DNA. In the absence of folic acid, the synthesis of DNA decreases, causing failure of maturation. Folic acid is also essential for maturation, is required for the synthesis of DNA. In the absence of folic acid and the synthesis of DNA decrease, causing failure of maturation.